All right. Good evening, everybody, and thank you so much for joining the Dr. C. Rochelle Ministries Life Chat series as we get ready to have a conversation with our guest this evening, Mrs. Maria Perriman. Tonight, let's talk Medicare. Medicare with Maria. So I am so glad to see some of you coming in. Come on in, and as you are coming in, please go ahead and click that like and share button. We will be more than happy to bring you into our conversation. Yes, let's see. Let me there we are. There we are.
Hey.
Yes, thank you. I see you're coming in. Bonita, go ahead and share. Robert Aaron, go ahead and share. Listen, we're going to be talking Medicare. I'm telling you, I'm getting ready to learn some things that I know I don't even know. But as I move, I was telling Maria a few minutes ago, as I move towards that age, Terry Murphy, I want to know more. So I'll be learned by the time I get there.
That's right.
Good good evening to you, Maria. Thank you so much for availing yourself this evening to share some of your knowledge and information that with us so that we can be better stewards of our own lives as it relates to health and things that uh, can we can it's a resource. There are sources and resources, and so thank you for coming this evening to share with us.
Thank you for having me. I really appreciate this opportunity and I don't take it lightly. I love educating and giving knowledge to individuals. We're busy people and we don't have a lot of time to do a lot of research and dig out this and understand that and take it all in and digest it and understand it. So if you have someone that's doing it for you and then you
Uh,
can get it, that's what I'm here for. So I really am excited about sharing what I've learned.
so just tell us a little bit about who Maria is, and how did you get involved with all of this, and just give us a little rundown about
Okay.
who is Maria.
Who am I? Oh my goodness. Let me try to condense it. But but first of all, I am a child of God. That's number one. I love the Lord with all my heart, and I am a believer first. I
Mhm.
am married to a wonderful husband, Alvin Perryman, who is the pastor of the mobile church.
That's my
And
friend.
and just we've been married now for 40 years. We have three children grown, and we have
Wow.
four grandchildren and a daughter-in-law. And just my parents are still alive, and I'm grateful to God. They're in their 80s and still in their right mind, health and strength, and
Wow.
driving and going here and there. And sometimes I can't even keep up with them. So, but just that's the personal part of me, and then the part of me that works is I am a part of the mission. Been doing mission work, and before the pandemic. And once the pandemic happened, of course, that ceased for a moment. But we are back. We're going to be back in 2023, back on the mission field. And so, not only that, but I was a Chicago public school teacher for 31 years. And your granddaughter, I won't forget how she used to always call me in the morning, right before I was going in the building.
Oh, my.
Yeah, right before I would go in the building, I would get that phone call,
That
and
girl would bring your phone. I said, "No, Maria, I didn't call you. My granddaughter is messing with this phone." And
yes,
those young people know about those. Oh my goodness!
hmm. So
But
that
I tell you, yeah, go
yeah,
ahead.
so I retired 5 years ago, and during that time, I have been, an entrepreneur, wellness coach, and just well-rounded when it comes to wellness. Now I have the insurance portion of it. I have the health and wellness portion of it, where I have a wellness store that you can get items from, and to keep healthy and to maintain a healthy body. But the part that I love right now too is the Medicare, because I can help seniors 65 and over, and not just seniors, but those that are under 65 with qualifying. Um, we call them qualifying. Um, they can qualify for Medicare, but they have to have issues that qualify for it. So
Mhm.
with qualifying disabilities.
Qualifying
Um,
disabilities. Okay.
yes, so we deal with individuals on that, and my husband and I are both. I work along with him now with that. Took me a minute to get there, but I'm loving this Medicare field.
Really? That's
Yes,
awesome.
yes, yes. So, whatever you need to know, I'm here to give you as much as possible. But I
Yeah.
want to just put a disclaimer out there that everyone is different. Everyone's circumstances is different. And I may not be able to answer your particular need because there's so many options out there that we would
Hmm.
have to sit down and put the options out on the table individually, because not one size it's not one size fit all. We were
Okay.
thought
Mm-hmm.
that, right? But
Mm-hmm.
it's so much out there, and there's so much money that you can keep in your pocket that you may
Hmm.
be putting out there for Medicare that you don't have to.
So before we get into the kind of meat and potatoes, I want to ask when you say a
Mhm,
qualifying issue or disability,
mhm.
um, uh, is there a number of years you have to be considered disabled in order to benefit or be able to get this Medicare, be qualified for Medicare?
As long as you're under 65, this is for if you have a qualifying disability and
Hmm.
receiving Social Security disability insurance payments for more
Okay.
than 24 months.
Okay. Okay.
Um, Now,
Wow.
yeah, that's for the other. But if you have an illness such as end stage renal disease or ALS, those you don't have to have the Social Security disability insurance for 24 months. You
Mhm.
you can qualify for that at any age.
So you said the end stage renal.
Mm-hmm.
Okay.
ESRD, those are the initials. If you
Hmm.
have end stage renal disease, you can qualify at any age for Medicare.
Wow.
Hmm.
And that's the only one.
And ALS, which is your Lou Gehrig's disease, if you
Okay.
have that, those are the only two that you can qualify at any age, um, for those without having that 24-month period.
Okay.
Hmm.
Okay. Now, so there are some different parts to Medicare. Like
Hmm.
I'm really still trying to figure it all out. I don't, just to help navigate us through the system, because you got Part A, you can get at a certain age or whatever. I don't know. Part B and C, D and E. I don't know. Because so if we're talking about these parts to
Mhm,
Medicare, like
mhm.
give me some understanding because I don't really understand it all yet.
Okay, so you do have the parts, part A, B, C, D, F, G, H, I.
Seriously?
Well, we'll talk about a little bit of each of those letters in a moment, but yes,
Okay.
yes. The part A is your hospital insurance. So you have your original Medicare, which is part A and part B, and part D. That's your original Medicare, right? So with the original Medicare, everybody is eligible at 65. And, of course, we talked about those that are eligible under 65 with the qualifying disability. So when you get that red, white, and blue card in the mail, right before you're 65, you should get it. If you don't, you have to call Social Security and let them know that you're ready to start up your Social Security. So you have Part A. which is the hospital insurance. And you have Part B, which is your medical insurance. So Part A, hospital, that's all hospitalization, hospice care, skilled nursing facility care. So those type of things are under Part A. And then you have Part B, and that's your physician services and any other specialist services that you have to go to. Now, each one of those has a premium. Part A, you may or may not have a premium for that. It depends on some factors. But Part B, everyone has to pay the Part B premium for original Medicare. And right now, that premium is $170.10 coming out of your Social Security check or coming out of your bank account. Either one of those. Now, can't get around that. You have to, that's something that, that has to come out your pocket. Now, some people may be paying more than 170.10 because of their income. So if you have a higher income, that premium will be higher. There are deductibles for Part A and for Part B. So Part A, there is a deductible of about $1,500, a little bit over $1,500. And then for Part B, the deductible is $233. Yes. So basically, your original Medicare is 80/20. 80/20.
Okay.
You're going to, it's 80/20. So you're going to come out of your pocket with 20%. Medicare will pay 80%. And you have to have the Part D. Part D is your drug coverage.
Okay. So we got people on the line. I know that Dr. Salisbury, Pam and Diane and Terry and Robert. Those of you who are on the line, if you have any questions that you may want me to ask Maria about Medicare, because I know some of you are qualified under the qualifying disability, but then there are others that are the 65 and older. And if you have some questions, please don't hesitate. This is an opportunity for us to be learned. DHC, what is DHC? The department, what is DHC, Pam? I don't know what that is.
DHC?
DHC has to approve. So DHC is that, Pam, does that mean there's, Deborah Franklin, how you doing? That means there's something in place where they pay the $170.10 for you? Is that what you're saying? I don't know. Is there some kind of program for that, Maria? I don't know what DHC is.
I have to see what she's meaning. If you are low income, there are some parts of it that you can receive, but you have to have the income for the Part B. And then some individuals are on their group plan insurance, and so they opt out of the Part B because they're in a group plan. So if you're in a group plan insurance, you can't opt out of that Part B while you're working. But once you are done working, then you have a certain amount of time to get that Part B. And if you don't, you will be penalized.
So penalized meaning?
Meaning 1%. Wait, was that 1%? Let me see. I want to make sure I get the percentage because there's two of them. You're penalized for if you don't get it. I know the Part D is the 1% per month, but the Part D, it's up to a 10% penalty.
Oh, so you have to get Part B.
B once.
B as in boy, which is the medical.
That's the medical. Once you're eligible, and if you don't, then that means you're still working and you're under a group plan, and it's underneath that group plan. So you don't have to get that Part B right away. But when you are unemployed or when you decide to retire, you have a certain amount of days for you to get your Part B.
Okay.
Without being penalized. If you're under a group plan.
So, okay. So if you covered by your employer. You don't
Correct.
have to worry about. Okay.
Hmm.
So that's part A is the hospital, part B is the medical, and part D is the drug.
Hmm.
All right. So I got that part.
Yes,
Now,
real simple,
so
real simple.
okay, and that's when you first apply at the 65.
At 65. That's original Medicare, Part A, Part B, 80/20 deductible. You have a deductible for Part A, you have a deductible for Part B, and you also have the premium for Part B
Mm.
for
So she
original.
said DHS. She meant DHS,
DHS, and what is DHS? I don't
Department of
know.
Human Service.
Okay, so does she work for them or is she under a group plan?
No, she doesn't work because
Okay.
she has I think she has a qualifying disability,
Okay, so
and
she
she's saying that I guess DHS pays her premium for her.
okay,
I'm
so
not sure.
so that may be, like I said, remember at the beginning that everyone's case is different. And
Hmm.
that, depends on, it's so many variables and factors. And that's why I
Okay.
said, even with tonight, someone had a question that we would have to sit down and look at all the options for that person. And there are many options out there. And
Okay.
there are people with qualifying disabilities can also qualify for help,
Okay.
and there's different levels of help. Mhm.
Oh, is that in the state of Texas, Pam? That they've approved a bill for that? Let me know because she said, look, they have approved that
Mhm.
bill where DHS
Mhm.
uh, can approve to pay the 170 for you.
Mhm.
So is
Yeah.
I don't know about the state of Illinois.
Mhm.
Maybe that's something
It might,
Maria.
yeah, Illinois is, yeah, each state is definitely different. I
Hmm.
am licensed in Texas as well. I have my license in several states, as well as being with more than 5 carriers within the state of Illinois. And whatever carriers are in the other states, I am also qualified to help individuals get into those plans with those carriers.
Okay. She
Mhm.
says everywhere. I'm just not. I've never heard of it.
I'll look it up. I'll look it up. Yeah.
Okay.
But I haven't seen it. We get trained every year and we go through the different, um, what's coming out for
Hmm.
2023. So,
Hmm.
they do have until October 1st to let us know what's coming up and down the pipeline. So I'll
Okay.
check that one out. Mhm.
Okay. Good. All right. So we on to the next part.
Okay.
Part whatever the next. Is there a
I
C?
did I
Is it?
did D. Okay,
You did.
D. I didn't
Oh,
I'll
yeah.
give you everything for part D,
No.
but
No. Okay. Go ahead.
okay, so
Part
part
D.
D is your drug coverage. And there is a premium for that as well, especially if you're going to keep with your original Medicare Part A, Part B. Part D,
Hmm.
you're going to have to also pay for as a premium if you choose a carrier for that. There are some zero premium plans out there for Part D, and we'll talk about that in a moment. But there is also a deductible for Part D, and that's $480. Now, for Part D, it really gets more intense because you talk about tiers, you talk about, um, the penalty 1% if you don't get Part D when you first come into Medicare. It's just a
Hmm.
whole lot. If you go over the 4,000 and something dollars, then you get into the donut hole, and it just gets to really be intense. That's why
Wow.
you need to talk to someone individually. It's best if you get an agent, because if you talk to someone on the phone, you make it a different person each and every time, and that person is not going to they're going to give you the information you need. I'll say that, but they're not going to give you the extra that an agent would do. You're not going to get
Hmm.
that personal touch. You know the agent knows you, and you can go to them at any time. And what we do is at no cost to anyone. So this is at no cost. So we could put everything on the line for you and say, okay, now you choose out of what we put on the table, you choose what is best for you. You can be in a group plan, but that's a group plan. So everybody in the group gets the same thing. But you want something individual. You want something that matches your individual needs. So that's what this information can also do for you with your personal agent. Then you also get the opportunity when you get those phone calls you're not supposed to be getting. Because you're not supposed to get a phone call unless you have allowed that person to call you. So I want to put it out there. If you're getting phone calls, because you are going to start getting them because AEP is about to start in October. And those phones be popping. Those advertisements on the TV pop with, call this number and we can get you zero plan benefits and da, 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 da. But if you can, when you pick up that phone and you don't want that person to call you again, you can tell them that you know that they're not supposed to call you unless you have given them permission. And if they call you again, you're going to report them to CMS.
Oh,
And not
wow.
you. Yep. I can't call anyone unless they give me permission.
Got you.
Mm-hmm.
Wow.
To talk about Medicare and what I can do for you.
So,
That agent is doing that. They are not supposed to.
oh, wow, wow, wow. Well, this is really good information because I'm telling you, as I shared with you earlier, I'm getting to that. I ain't rushing. I'm not rushing it. I'm not. Uh, I'm I'm gracefully moving toward that way, and I know that by the time some of us get 65,
Mm-hmm.
legislation will have changed again.
It
You
changes
know,
every year.
see,
Every year.
wow.
Premiums can go up every year. Mm-hmm. And last year went up for the first time in a while. It was at Part B was 148 a month, and it went up to 170.
Oh, that's the $170.10.
Mm-hmm.
So
Mm-hmm.
then, if, for example, we have people who retire because of age and not because money. They
Right.
have the money to retire
Mm-hmm.
and are at that age, 65, 66, 72, whatever it is, and they don't. I mean, I'm looking. We're talking about these premiums going up, 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 up. Excuse me.
Mm-hmm.
That comes out of their check that
Yes.
they get Social Security. So you have no say so over that. That premium is so the. It's amazing how government works. Oh my
Yes,
goodness
yes, yeah,
gracious.
no say so. It comes out automatically. If you want it to come out of there, they give you the option. Do you want it to come
Okay,
out of your Social Security or out of your bank account?
got it.
Hmm.
But either way, they gonna get it.
It's coming out. It's coming out.
Wow.
Yes.
So, what are some new things that we can look forward to right now? Because I know you said one of your big dates, enrollment dates, is October 15th.
Hmm.
That's one of your busy, busy dates.
Hmm.
So, I mean, are there some new things that people should know about?
Yes, but we cannot talk about them until October 1st.
Oh, snap.
Yes, you cannot say anything until October 1st. And then after that, individuals can start enrolling in different plans on starting October 15th all the way through December 7th. And those plans take effect in January.
So, well, then, Maria, if anybody wanted to get in touch with you to call you,
Mhm.
is there a number that they can call?
Mhm. They
Okay,
can
let
call,
me put it on the screen.
okay,
Okay, what's that number?
at 847
Hmm.
863
Yes, ma'am.
5481.
Okay. More questions
And
about Medicare.
and I do have another part that I did not mention
Okay.
that I want to definitely mention, and that's the Part C.
Okay.
Um, and those are your Medicare Advantage plans.
Okay.
And your Medicare Advantage plan is a wonderful option for you to look into, especially if you don't want that 80/20
Mm-hmm.
um, original Medicare. And I
Okay.
say that because when you go into the hospital, you have to pay the deductible, right? First. And then you have to, if you go over that deductible, everything is 20% over that. So say you're in the hospital and the bill is, I'll say $50,000.
Mm-hmm.
So you pay your deductible and then you still have to pay 20% of that 50,000.
So you still got a bill.
Still have a bill. So what people do is they choose two different options or an additional option. And one option I'll start with is the Medicare Advantage plans, which is Part C. And they also include Part D. Some of them do. And they also include extra benefits. I don't know how many of you with original Medicare, you have your Part D, which is your prescription drug plan, but then you still need dental work. You still need vision, and you may even need hearing, or you may go to
Mm-hmm.
the workout. You may need vitamins. You may need some things that you have to pay out of pocket,
Mm-hmm.
right?
Mm-hmm.
Or you'll
Mm-hmm.
have you'll have a dental and vision plan that you're paying a premium every single month for.
Mm-hmm.
So you can see how all of these add up.
Mm.
That's with the original Medicare. Now, Part C came along and says, okay, if you want a Part C, which is a Medicare Advantage plan plus the drug plan, we can give you some premiums at zero premium.
Oh wow.
We can,
So
yes.
so uh, original Medicare
Hmm.
uh, with that has the premium, and if we take advantage of the Part C, which is
Hmm.
the Advantage plan,
Hmm.
there's a possibility that there will be no premium.
You'll still have Part B. That's going to always be there. You're going to
Oh,
still have Part
oh,
B. That's
oh,
going to
okay, okay.
always be there. But Part C is coming along to help with, you know, instead of it being 80/20, they give you a maximum out of pocket expense.
Okay.
So, an example would be one company, because every company has a different one. Every carrier, I'll say, has a different one. So one
Okay.
carrier may say, okay, my your maximum out of pocket if you come with us will be $2,900.
Mm-hmm.
That's the maximum you have to come out of your pocket, whether you have a $50,000 note or expense
Uh-huh.
or a $200 expense.
Wow.
Maximum
Listen.
out of pocket, 2,900. Boom. I've just had surgery and it was 50,000. All I have to pay is 2,900.
Wow. That's amazing. Ooh, I tell you.
So you have to weigh what you want. Now that's one way.
Okay.
And I have to make sure I mention the other way as well. But that's another way. And then you have your specialists, you have all of those co-pays and everything that adds up to your maximum out of pocket.
Mm-hmm.
Can't go over that. Not supposed to go over it. You also, with this Part C Medicare Advantage plan,
Uh-huh.
you
Mm-hmm.
can have a zero premium Part D.
Oh, Part D. Okay.
Be a zero premium. Right now, if you're with the original Medicare, you're paying a premium for your Part D.
Uh-huh.
So
Okay.
you can
That's
slash
that 200 and some dollars.
the premium for Part D varies according to what carrier you choose for your Part D.
Okay. Okay.
Mhm, mhm.
Okay.
But remember, 170/10 is there unless you
That's
have some
that's
type of
Part B.
special program.
That's
Part
Part B.
Part B,
Sub
B
B.
as in boy. Mhm.
Gotcha. Okay.
Yes.
Okay.
So the Part C also has extra benefits. I know there's a lot of people that have, They have part A, they have part B, they have part D, and then they have to go out and get a dental or vision plan, or even
Okay.
some type of hearing plan. And that's extra money out of their pockets, right? But with your part C, all of that's included in the part C: dental, vision, hearing, fitness centers, go for
What?
free and work out, silver sneakers. Uh,
Wow.
They have so many different extra benefit perks. Some even have meal plans. Some have OTC cards, over the counter cards, like a credit card. Every 3 months, they load it up for you. You can go shopping on it. They range from $60 all the way up to $475 every 3 months. It
Wow.
depends on which plan you pick. So it is that, I mean, that part C is golden. When you start seeing the amount of money that people start saving when they choose that route, it's
Wow.
amazing. That's part C. D. So there is some hope. There is
There's
some
some
hope.
hope.
There's
Okay.
some hope. Then you
Okay.
have, some people say, I'm going to have original Medicare, but I'm going to choose Medigap insurance. And that's
Oh
your
wow.
supplemental. That's your supplemental. And that takes care of all of the expenses of you having to have if you stick with original Medicare. So um, I had, ooh, did you just see Pamela's comment?
Yeah, yeah, I just put it on the screen. She said she had stem cell transplant and it was $1 million. Yeah, takes my breath away.
You took mine. It stopped me right there. It stopped me.
So Pamela is a blood cancer. Uh, she's still going through chemo and
Mm,
that kind of stuff. She's in Houston,
okay.
Dallas, one of them Texases.
Hmm.
Yes.
Wow. So
Hmm.
does she, well, I don't want to ask her any of her personal business right over the line, but
Yeah.
some people, because they do have astronomical bills like that and they know it, that they're going to have that when they get on Medicare, they go ahead and get the supplement, which is the Medigap, because that will work out better because it'll take care of all of that, the extra. Yeah.
Pam, you did you hear that, Pam?
No.
I'm not familiar with Medicare, Pam. But Maria, this is Maria's phone number.
Mhm.
Um, I would say call her and ask her about the Medigap insurance. Because I know a lot of us. I know when I my car, I got Gap insurance on it,
Mhm.
just in case something happens and the
Yes.
insurance doesn't cover it all. Where the Gap takes care of it all,
Mhm.
and that kind of thing. So she said it's fine. You can ask her questions. She doesn't matter. Mind.
Okay. Are you Medicare age?
Pam is 60. Pam, how old are you? 60? I know she's a few years older than I am.
Okay.
Um, but I think Pam, are you're not Medicare age? I think she's with the
Mhm.
qualifying disability. I think that's
Mhm.
what hers is. I'm not sure.
Okay.
Pam, are you 65 yet, Pam? Um, it'll be good if I could bring you on here, then you can talk to her directly.
Right.
Pam,
Well,
can you?
there, if she has a qualifying disability, she can get Medicare now.
Yeah,
Mhm.
I think
I don't know what
she.
her insurance, yeah, that's why I said we would have to talk personally,
Right.
look
Yes.
and see what she has and then what her options are. I wouldn't
Yeah.
wanna do that over
No,
Facebook.
no,
Yeah.
yes, absolutely.
Mhm.
Um,
Because there's HIPAA
co-
rules.
that's it. That's it.
Yes,
That's it. That's
yes.
it.
So we will
Um,
keep it
yeah.
offline. Yeah.
Well, look, time went by so fast.
It sure
It's
did.
after 7 o'clock already.
Wow.
Uh, whew, uh, man,
Yeah.
man. we need to know that new information after October 15th, whatever that date
After
is.
October 1st, we can talk
Oh,
about it. Every
uh,
plan, every carrier has a different program that they offer with the
mhm.
Medicare Advantage plan. So you have Blue Cross Blue Shield, you have Humana, Cigna, um, you have
She says
Humana,
she's
Cigna.
62.
Okay, okay,
She's Medicare. She got
okay,
Medicare and she's 62.
okay. We'll talk offline. Yeah,
Hmm.
we'll keep it offline. But yeah, so you have all the different carriers. You have new carriers such as Devoted. Aetna's still out there. You know, Cigna's still there. We have Devoted. We have WellCare. We have all kind of carriers. And let me tell you this: the carriers all do the same thing. They just pay your bill. So don't be married to none of them. Go to the one that will best benefit you, that has a nice 4 or 5 star rating, and you will be fine. So I know I've always, all my life, had Blue Cross Blue Shield, but I see that there are many other carriers out there that do much better than what Blue Cross Blue Shield can do for me. But you know,
Hmm.
Blue Cross can be good for you, but Cigna can be good for you too, or Devoted, or whoever. So you always have to look at all your options and see which carrier is best for you, and know this, that they all have to pay the bills for you. So it's just the name, but see what
Oh,
they can
okay.
do for you.
Um,
See what they can do for
it's so like Humana
you.
Gold.
Mhm,
You know, I hear a lot about that because I know I had one particular person. I wish she was on here so
uh-huh,
that she could get this information from you. And
mhm.
I know we kind of went back and forth
Yeah.
um, with her trying to get some psychological
Mhm.
help,
Okay.
and they live in Illinois, but Humana Gold sent
Oh,
her to Indiana,
okay.
but when she went and got the service, they refused to pay. So she could take advantage of somebody who knows this system and can help her kind of
Mhm,
navigate through
mhm.
some of those things.
Oh, yes.
So
Yeah.
man, this has been dynamic.
Mhm.
What else you want to share with us?
Um, like any grievances that she may have, she can call CMS. We had a situation where we ended up having to call CMS to get it rectified. That's why I said it's
Mhm.
good if you have your own agent, because you can get some things done that you couldn't get done with someone that you applied with or enrolled with over the phone, because you won't get that same person. And so we helped her, and she was able to get everything rectified, and everything was put back in order, and it was straight. We also
Mhm.
have helped individuals with putting more money back in their pockets. Some people are paying double premiums and they don't know it, because everything is just coming out of their checks, so they don't really check anything, especially if you've
Uh,
had Medicare for over the years. So if you're a caregiver of your parent, or you have someone that you're taking care of, have them look at their social security. And some people are having social security part B taken out of their checks, as well as being in a group plan that they have to pay a premium for to be in that group plan. You don't have to have it like that. So we comb through and we see, exactly how we can help individuals to just pay what they're supposed to pay in. A lot
if
of
my
there.
if my daughter hadn't been at the grocery store, I really wanted her to be on here so she could hear this information
Mhm.
as well because she's 31, but she's Medicare.
Okay.
Yeah, because of her
Okay.
qualifying situation.
Mhm. Well, we can talk
And,
to her separately. Is
yeah,
she in Georgia? We have our license in Georgia as well.
yeah, she's in Georgia,
Yeah, we're
and
licensed
I
here.
think she could benefit from understanding all of these things that
Mhm.
that you're sharing with us.
Mhm.
And so, we're just here to,
Yes.
to bring information to people. So
Hmm.
whatever they choose to do with it is totally left up to them.
You're
And
right.
so I really appreciate you taking time out. I know we said 30, 40 minutes. We've already reached the 40-minute mark. I tell you, time went by fast. I'm telling you,
It
I'm
went
looking at the
really fast, and I was like, all day, and it went so fast. But yeah, I'm passionate
yeah,
about this and helping others and making sure that they know what they need to know. And once you know it, do like you said, do with it what you need to do with it, and or run with it. Run with it. We
hmm
need to put money in our pockets in more ways than one back in our pockets right now because everything being so sky high. Use that
yeah,
money for gas. That you
yes.
know, um, groceries.
Pam said when she had her private insurance is when she found out she had cancer.
Mm,
It was when she had her private insurance.
okay.
And you know what, Pam, I would suggest that you even just call Maria.
Mhm,
You all kind of could go through some things, and she may be able to find you some other things that you didn't know about.
mhm.
And with all the new stuff that's coming in October the 15th.
October
Uh,
1st, we can talk about it.
October 1st, October 1st. October 15th is enrollment,
It's
enrollment
enrollment.
starts.
Yes.
Okay, yeah. So October 1st, she'll be able to, even talk more about it, about to you, some things you may not even know about, like,
Mhm,
whatever. And so that's why I want to encourage my daughter to give her a call.
mhm.
It was her daughter calling her, but I'm gonna now tell her to call. I tell, I'm gonna tell her to call you,
Yes.
Maria.
Okay.
So, she can talk to you about, you can share with her some of the things that you've even shared with us on tonight.
Mhm.
And so,
Definitely.
listen, I got Maria's information here. You all can call Maria, and with any questions about Medicare that you may think you have, and her number is there on the screen. And as passionate as she sounds while she's
Mhm,
talking to us here today, I know she will treat you in such a manner. And
mhm.
so, Maria,
Thank you.
thank you so very
Thank
much.
you.
This
Thank you.
was this was great. We had a number of people to come through, pass through,
Yeah.
and a few of them stopped through and looked and listened, but didn't say anything. Pam has been the most active. Everybody else is just kind of looking. Uh, Robert Aaron, I know that you are in Florida,
Yes.
and if you have questions, give Maria a call. Hey, Lady Michela, so glad to see you come in. Susan Hodges' wife. Um,
Oh, yes. That's my
yes,
friend.
yes.
Oh,
And Pam said, "Thank you so much.
thank you,
She
Pamela.
really appreciate it." Pam, get Maria's phone number off this screen, write it down, and give her a call and let her, answer some of those questions about Medicare that you may have, or let her share with you some
Mhm.
of the new things that she can share after October 1st. On
After
October
October
first,
1st. And remember,
yes,
it's no cost to you at all. No
and
cost.
it's free service to you. She
Yes.
may be getting paid, but it ain't from you.
No.
All right. There we go.
That's
So
it.
thank you. She said, okay. Pam said, okay. Thank you, Lady Michelle. I appreciate you, darling. And so, listen, thank you all so
Thank
much
you.
again for joining us for this live chat series talking about Medicare with Maria, the expert on this subject. And so, well, I appreciate you because I'm telling you, I want to know all I can know. It
Mhm.
won't be a surprise.
Won't be.
No, I don't want to be okay.
No, you'll even know which is the best carrier to go with. So,
Oh, yes, that's
mm,
good. That's great.
yes.
Thank you all once again for your time. Those of you who engaged, Pam, thank you so much. Pam is a blessing, and we look forward to bringing Maria back just to
Amen.
share with us the new stuff. New stuff, because I'm sure to be able to benefit many of us. All right.
Amen.
Any last words, Maria?
I'm done. I'm
Uh,
done.
All right. Well, listen. Thank you all and have a really, really amazing night. Is that you got some papers in there? 'Cause I'm telling you, because your sound, honey, your sound is so good.
Oh,
All right.
really?
Ooh, honey, it's like sharp.
Oh,
Yes.
I just have my ear.
Oh, it's moving around on some stuff. That's why.
Oh, okay. Okay.
Yeah, it's okay. I'm good though. I'm good.
Okay.
Don't go anywhere, Maria. Hold on a
Okay.
second. The mission of Dr. C. Rochelle Ministries is to uplift, motivate, encourage, and inspire others to live their best lives. All right.
All
Yes.
right.